Well, hello. Welcome to the Jim Inkster Show. Jim Nichols sitting in for Jim Inkster, who's taking a well-deserved day off. And I'm glad to have you with us here on 89.3 WRKF in Baton Rouge. Some great guests for you today on our show. Dionne Viator, the Executive Vice President and Chief Business Development Officer for the General Health System, also known as Baton Rouge General, will be our guest. And also Michael Polzine, the Vice President of Corporate Communications for Walgreens, will join us later. And then we'll close the show with Doug Morrow, the longtime district attorney and DA and voice of or color analyst for the Tigers. We're going to talk a little bit about the Penn State, but much of the show will be centered on health care and the constant dynamic changes that are taking place both locally and nationally, and we want to make sure you're a part of that conversation. So join us on the Jim Inkster Show. We'll take a short break for a news update, and we'll be right back. Back to the Jim Inkster Show. Jim Nichols sitting in for Jim Inkster. He's taking a well-deserved day off. We have a kind of a healthcare themed show today. We're going to talk to Dionne Viator with Baton Rouge General and General Health Systems. We're also going to talk to a gentleman with Walgreens about the impact of healthcare reform on the industry, the prescription drug industry, and particularly the drugstore industry. And then we're going to end the show with a brief visit with Doug Morrow and talk a little bit about the ongoing situation at Penn State, which seems to be on everyone's mind. A reminder that today you can support WRKF and have a chance to win a trip to the Festival of Lights celebration in Natchitoches. And when you give to WRKF between 7 a.m. and 7 p.m. today, we'll automatically enter your name into a drawing for a weekend trip December 9, 10, and 11 to Natchitoches for the Festival of Christmas Lights. The winner will receive a prize package for four. You call 855-893-9753. That's 855-893-9753. I've been to that Festival of Lights in Natchitoches. It's awesome. It's really, really a neat treat. So call in, make your pledge of support, help WRKF. 297-5633 is the number in Baton Rouge. 877-217-5757 is the number toll free to call and visit with one of our guests. And we're going to start with Dionne Viator. Good morning, Dionne.
Good morning.
It's great to have you in studio here. And of course, all of us here in the Baton Rouge area are very familiar with Baton Rouge General and General Health System and your impact and what all you do in the community, and we thought it would be nice to kind of visit and have people know a little bit about more of what y'all are doing, what the future holds for Baton Rouge General. But let's start out with you. I was looking at your vitae and your resume, and you are a certified public accountant by education and trade. How does one go from being a CPA to being the executive vice president and chief business development officer for a hospital?
Well, first, thank you for having me.
Sure.
I appreciate it. It is an unusual path.
Right.
Went to USL in Lafayette, Louisiana when it was USL. Majored in accounting. Liked the business side of things. From there, moved to New Orleans. Didn't know that healthcare was in my future at that time. Public accounting with Ernst & Winnie when it was Ernst & Winnie, now Ernst & Young. And worked there for about 7 years. Had the experience to work in oil and gas and a lot of different industries. And healthcare became my passion. So for almost the entire 7 years there, I worked exclusively in healthcare. The complexities of the Medicare and the Medicaid and the funding really drive a lot of the decisions that you need to make in healthcare, and that became my path.
And you ended up here in Baton Rouge, and you've been in Baton Rouge how long now?
18 years, a little over 18 years, and
so
all of them at the General. A lot of different roles at the General.
Have kids here in school in Baton Rouge, and you're pretty much planted right here.
I do. 2 kids. One graduated from Parkview Baptist and at LSU now, and the other's still there.
So Baton Rouge General, give us a brief history. I mean, folks drive by Baton Rouge General facilities. I think they have a little bit of an idea of what y'all are about, but give them a little history of when did we start and when did y'all start and where are we going?
That's a big question. I think when you look at the Baton Rouge General's history, it is over 100-year history. I'll try to give you the brief version, but it basically started with a train wreck back in 1900, where Dr. T.P. Singletary treated the train wreck victims and saw the need for the first community hospital. So from there, funding.
And the first location was on Government Street?
On Government Street. A little 4-story building was built, 62 beds on Government Street. So kind of an interesting progression. That wasn't big enough.
Right.
The School of Nursing was also started back in that time, back in the 1920s. And the Louisiana Baptist Convention actually came into town, took over the operations, and expanded the hospital to 250 beds, and it became located at 3600 Florida Boulevard, where it is now today.
So has the mission changed? I mean, you're a community. Explain to our listeners what's a community hospital as opposed to a for-profit hospital. I think folks sort of, with so much going on in healthcare, they get confused on what roles different facilities play. What's a community hospital, a nonprofit community or not-for-profit community, which is what Baton Rouge General is, right?
Right. In about 1969, the Louisiana Baptist Convention actually handed this hospital to our community to own and operate. And what that means is that we have a board of directors that are all community citizens. We have pastors and judges and business people and a lot of lay people not necessarily involved in healthcare, and some that are. Guiding our organization and how we provide health care to the community over the years. It's a self-perpetuating board, so different community members rotate in and off the board over the course of the year. But the community does own Baton Rouge General, and through that leadership of our board, there are no distributions of any funds to any owner.
There's no stockholders. There's no
stockholders,
board dividends or anything like that.
Everything that Baton Rouge General is able to raise through donations or operating profits is reinvested back into the health care that is delivered by the organization.
Jim Nichols sitting in for Jim Inkster. You listen to the Jim Inkster Show on 89.3 WRKF in Baton Rouge. 297-5633 is the number in Baton Rouge. 877-217-5757 is the toll-free number. And, of course, we are asking you to help support WRKF, a community treasure. So call in and make your pledge of support while you're listening to the show, and we can keep this great local programming like Jim Inkster alive, as well as all of the wonderful national program that we have to purchase through your funds. So please call, make your pledge of support. Dionne Viator, our guest. We're going to talk to a gentleman with Walgreens a little later, and then we're going to close out with Doug Morrow. But staying with Dionne and Baton Rouge General, I don't think folks know we have a medical school right there taking place on Government Street. Is that right, at Baton Rouge General?
Absolutely. A lot of teaching going on right there at the Mid-City Hospital. We have an affiliation with Tulane School of Medicine where we are actually a satellite campus. We are in our second year of that, and the goal is to plan to increase the students. They are the third and fourth year medical school students actually getting their complete experience at the Mid-City campus, and we expect that to grow over the course of the coming years to the largest satellite campus of any medical school in the nation. So very exciting there, not only about the education of physicians there, but our school of nursing. We also have a PharmD program by Louisiana School in Monroe, as well as other teaching programs on that campus.
So while you're taking care of the community and the healthcare, you're also educating people, and I have to segue into the natural question, and that is the economic impact of the Baton Rouge General. I mean, you have a facility on Florida, you have a facility on Bluebonnet, you have a medical school. You tell folks how many people work for the Baton Rouge General. I mean, do you have a ballpark number?
Baton Rouge General employs over 3,200 people. When you look, when you talk about the economy and the economic jobs, it's all about jobs.
Yeah.
So over 3,200 people. We are a 7-day-a-week, 24-hour-a-day operation. So between the two campuses, we have a payroll in this community of over $50 million a year. In addition to that, when you talk about economic impact by training medical school students and residents and preparing for the future caregivers for this community, I think that is an equally important role of the Mid-City Hospital, and one that we take very seriously.
So the Earl K. Long is the facility that is going to be closed, and this is a state-owned facility. For our listeners that don't know, it has been the quote-unquote charity hospital in the greater Baton Rouge area for as long as I can remember. It is going to close, and we're going to see a change to some extent into the indigent care in Baton Rouge. How is Baton Rouge General dealing with that, and what do you see happening as Earl K. closes? I know they're going to have a facility out there for, I guess, some health care, but it's not going to be a hospital. How's that going to impact the overall health care in Baton Rouge?
Correct. Louisiana is a little bit different in that instead of the dollars that are spent by the state following the patients and where the patients choose to go for their care, the dollars are assigned to a facility, if you will. So all of the funding for care for the citizens of the area that are not able to fund the care on their own has been attributed to Earl K. Long. As a part of the redistribution, The state has now said that all of the inpatient care needed and all the funds that go with that will move to Our Lady of the Lake. So what we expect by the state's decision in that case is that this will be a complete redesign of how care is delivered in Baton Rouge. Our Lady of the Lake, I know, is preparing for that by building and infrastructure and things like that. So we now are looking at how we can serve the community in North Baton Rouge a little bit differently as we move forward. Looking at the population in North Baton Rouge, and it is an aging population. How we look at refocusing Mid-City, not only on teaching, but focusing it on seniors and a lot of the senior programming that needs to be done there. So
tell us a little bit about that. It's my understanding y'all are going to be making some improvements and changes at Mid-City for seniors, and that's right around the corner.
Right. We've added geriatricians, and we've added a lot of new programming, increased some of the services specifically needed by seniors and catering to the senior experience through the emergency room all of the way through the hospital. We do expect other changes in the Mid-City area also. Very excited to have been working with the mayor's office and Future Baton Rouge as they focus a lot of attention with the development of the Mid-City area and what that might be able to become, not only as a medical corridor, but as a medical education corridor between what we're doing and what Baton Rouge Community College is doing.
Jim Nichols sitting in for Jim Inkster. Please help WRKF today by calling and making your pledge of support. We need your help to make sure that we keep this wonderful community treasure known as 89.3 WRKF alive and well, and we are taking pledges today and hope you will make that pledge of support. Later on, we're going to be talking to Doug Morrow about the Penn State developments that happened overnight and through this week, but right now we're talking to Dionne Viator with the Baton Rouge General. 297-5633 is the number to call. Locally, 877-217-5757 is the number toll-free. And we do have a call for Dionne if you want to take it. We're going to go to line 3, and this is Dan downtown. Dan, go ahead. You're on with Dionne Viator.
Yes, you say that yours is an unusual path of leadership, but is the case that bean counters with a focus on the bottom line are really running corporate America rather than doctors with a focus on patient care or engineers with, quality of cars and other products?
Okay, he kind of broke up a little bit on that, but I think what he was trying to talk about is the dynamic of corporate bottom lines and dividends and stockholders and expecting a result, and how do you balance that with caring for people in the healthcare industry?
Well, I think the background is actually, I think as he was alluding to, actually one I found very beneficial. If you look at kind of what's going on in the nation with healthcare right now, and everyone expecting value for their dollar in healthcare and quality and other things, how it's all financed is very important. But the focus on where we're going with accountable care and how we provide more for less, the background has been very useful in trying to be creative in those aspects.
Tremendous challenge, and there's so many players in healthcare now. I mean, you've got for-profit hospitals, not-for-profit hospitals. You've got doctor-owned hospitals now. You've got, it is just a constant, ongoing change in the players, and then you've got a change in the payers, right? The federal government is consistently changing and making your life, I'm sure, very interesting by how they reimburse. Then the state has started the coordinated care networks, and the state and Governor Jindal have pushed forward a way they're going to deal with indigent care. So it's got to be, for someone like you and for Baton Rouge General, every day is a new day, and it's got to be challenging for everyone. Healthcare executives across. Do you participate in national groups, and how do you keep up with these constant changes?
Absolutely. I think that we are, from a national perspective, are very involved and on the forefront of trying some pilots and different things here, even in Baton Rouge. As you mentioned, the reimbursements are continually declining. Our focus is how do we reallocate resources, keep as many nurses and increase nurses and caregivers by the bedside, and do that through technology and through other care coordination in a way that improves the overall quality that's provided. With the continued declining in reimbursement, we are looking at ways to find cost savings, to share cost savings, to do some pilots that we have recently launched. One, for example, would be with Blue Cross and Community Blue, and a narrow network product that takes and pilots a lot of the accountable care concepts that we hear out of the National Healthcare Reform Bill and try to move that forward here in Baton Rouge.
Jim Nichols sitting in with Jim Inkster. Our guest is Dionne Viator. She is the Executive Vice President and Chief Business Development Officer for General Health Systems, the Baton Rouge General Medical Center. And we're going to take a little break in a minute, and we'll come back and talk some more with Dionne. And then we'll talk with Michael Polzine with Walgreens, and then we're going to finish out with Doug Morrow. But you're listening to WRKF 89.3 in Baton Rouge. Please call, make your pledge of support, and we'll be back in just a couple of minutes.
Thank you, Jim. Today you can support WRKF and have an opportunity to win a trip to the Festival of Lights celebration in Natchitoches by giving to WRKF before 7 o'clock tonight. We will automatically enter your name into a drawing for a weekend trip December 9th through the 11th at Natchitoches for the Festival of Lights celebration that is internationally known. The winner gets a prize package for 4. This has been quite a fall for programming on WRKF. The 10th anniversary of the 9/11 attacks on the U.S. was an important time for reflection, and nobody covered the anniversary better than the folks at National Public Radio. More than $225,000 a year goes from WRKF to NPR to keep the programs coming. All Things Considered, Morning Edition, all made possible through contributions from listeners like you. Here in Baton Rouge, we heard from Bob Edwards, the man who was on the air on 9/11/2001. And Bob Edwards is a reason why people listen to the station. He remains part of the WRKF family, even though he no longer is on Morning Edition. Steve Inskeep is, and he was a guest on this show a few days ago. 1-855-893-9753. That's the number to call to make your contribution to WRKF on this one-day fund drive. And remember, if you get in time before 7 o'clock tonight, your name will be in the hunt for a great celebration of the holidays in Natchitoches for the Festival of Lights. 1-855-893-9753. We seek your support. We don't do it often, but this is the day. It's your day. Please call 855-893-9753 or go to WRKF.org anytime and make your contribution online.
Welcome back to the Jim Inkster Show. Jim Nichols sitting in for Jim Inkster, who's taking a well-deserved day off. We're talking about health care in today's show, and we're going to close with a little bit of the topic of the day, and that is, of course, what's going on in Penn State when we talk to Doug Morrow. But we've got a few minutes left with Dionne Viator, who is with Baton Rouge General and General Health Systems. And we've, I think, had a very interesting conversation so far. 297-5633 here in Baton Rouge, 877-217-5757, toll-free anywhere in our listening audience. And Dionne's been very good to share with us a lot of what's going on with Baton Rouge General in the local area. And I think it's very interesting to talk specifically about one of the incredible assets that Baton Rouge General has that I think some people know about it, but a lot of people don't, and that's the Burn Center. Let's talk a little bit about its unique spot in healthcare. I mean, there aren't a lot of burn centers in Louisiana. There aren't any as we have on Florida. But tell us about the Burn Center at Baton Rouge General.
Burn Center is something that is a much-needed community asset, and there at our Mid-City campus. It opened in about 1970 as the only burn center in the state. It is actually, we serve Louisiana, Mississippi, Florida, a wide region. We take care of children all the way through adults. The only other burn center in Louisiana is now at LSU Shreveport, at the Charity Hospital system there. But something that we're very proud of. A lot of people think a burn center, why is that needed in this area? There can't be too many burns. Yes, I mean, we have the big automobile accidents and things like that with the chemical plants here, very important. But you'd be more surprised just with our lifestyle here. Mm-hmm. Many of our burns are the crawfish pot that is knocked over, or the child heating up something in the microwave, or the fish fry.
And I've been up there. It's a very unique form of care. It is not like anything else you see in a hospital setting, particularly the people that work up there. I met one woman there who's been there, I think, almost since they opened, and she has actually gone and taught other hospitals how to deal with burn treatments. But it is a different kind of care, and it is so important in this area. And I think it's interesting that people, if you get burned bad in Louisiana or in Mississippi, you likely end up on Florida Boulevard.
You want to be at the Baton Rouge General, yeah. And it's a different type of care. It's a very family caring atmosphere. The nurses at the Baton Rouge General take a lot of the children to a burn camp once a year. Mm-hmm. Those children often don't have time to just feel normal. with a lot of their scars and things like that. Very rewarding.
The stays tend to be longer. The recovery's longer. I noticed you guys have built their own. You have your own waiting room now for the burn center. It's a setup all in itself, right?
We have patients from a few weeks to patients that have lived with us over a year. Very difficult for the patients and the families, but we have nurses and caregivers that just thrive on that.
Okay, so healthcare reform passes in Washington. It's starting to be implemented in 2014. You've got these constant changes going on with technology. You've been involved in healthcare now for some time. Where do you see Baton Rouge General in the coming years, and also where do you see healthcare in the next decade? I mean, 10 years from now, I'm going to wake up, what's going to be different and what's going to be the same, you think?
10 years is a long time. Even just 3 years in healthcare is a long time. But I think that, we've got to look forward. Right now, the federal government is primarily focused on just reducing cost. And the hospitals are also, but we have to do things differently. When you look at the state of Louisiana right now, about a third of the hospitals are operating with a negative operating margin. That's not sustainable. Hospitals are operating for the rest of the state around 2% operating margin. We've got to do things differently, and so by investing in technology and the coordination of care between caregivers and moving forward with some of the pilots I spoke about earlier, we believe we can move forward with some of the accountable care concepts. I don't know if how it's constructed today is how it'll move forward, and of course the election next year is going to be a big part of trying to forecast 10 years out. I don't even know if I can forecast 12 months out with the election and some of the repeal talk and things like that. But those core concepts are going to be the same regardless of accountable care.
And the costs continue to go up, and the reimbursements continue to be a challenge from the government, and I'm sure the private sector tries to squeeze out as many dollars as they can as well. You talked about early, as we started the show, about how many people that work for Baton Rouge General, and you said it was how many people?
Over 3,200 employees.
And tell us about the people that work for Baton Rouge General, and tell us about, I mean, I don't want people to think you're just some bean counter over there. You're actually walking the halls and talking to people. Ultimately, it's a people business.
It is a people business. The people that work at the Baton Rouge General, and particularly our nurses, are the strength of the organization. We have a campaign going on right now where tell us your BRG story. Oh, yeah. And as I've looked at a lot of those stories and had a chance to talk to a few of them, it is amazing what our caregivers do that we don't even see every day. Whether it's a Pennington Cancer Center patient who chose our hospital over a big-name cancer center and is now cancer-free, or a Womack Heart Center patient who received a heart valve replacement through a keyhole-size incision and is living an active life today, or an emergency room patient whose life was saved by the trauma team. The stories are so touching.
It's ultimately a people business. Baton Rouge General been around a long time. Do you see physically any changes with your presence on Florida? You've got the Tulane Medical School. It seems as though you may be expanding somewhat building wise. How do you guys afford to do these things? Is it charitable giving? I mean, you have an annual fund drive and an annual event that you try to do to raise money. These are things that are paid for by the goodness of the community, correct?
Correct. We are very dependent on philanthropy, and particularly to your question about Mid-City, philanthropy is what has caused us to be able to renovate and cause a lot of nice space on the burn unit for patients and their families with their long stays to make them more comfortable. Also, our employees have given money and renovated space in our emergency rooms for children to be able to stay and play in those emergency rooms. But philanthropy is a key part to healthcare, as it is education and others, and do appreciate the support of Baton Rouge General.
Our guest has been Dionne Viator with the Baton Rouge General. She is the Chief Business Development Officer, the Executive Vice President, and she's a Baton Rougean who is working hard every day to make sure that healthcare continues to be delivered to a lot of folks in a lot of different ways. And she's got a tough job because every day something different.
Always different.
But it looks like she enjoys it. She's smiling, at least so far. But it's great to have you on WRKF. Thanks for being here, and thanks for everything the General does for the community. We appreciate it.
Thank you so much.
Jim Nichols sitting in.